Hi, I'm Bob Lederer, and welcome to Pharma Research VIDEO Report, where pharmaceutical, healthcare, biotech, and medical device market researchers come for news, insights, and commentary about their respective fields that they just won't find anywhere else. We've got a particularly diverse group of stories to cover with you today, so let's get started. HealthITAnalytics.com reported that researchers at the University of North Carolina at Chapel Hill have developed FutureDocs Forecasting. It's an interactive online tool that helps healthcare organizations uncover the root causes of a projected physician shortage in the hopes that these can be addressed before they actually take hold. FutureDocs Forecasting examines models of community-based future physician employment, taking into account elements like Medicaid expansion, state-run health insurance exchanges, doctor retirement rates, and use of other medical professionals, among many other factors. Erin Fraher, PhD, leader of the program on health workforce research at UNC Chapel Hill, stresses the need to think and plan locally, although she says there are national repercussions to the work. Quote, "The model is not intended to provide a single right answer. Our hope is to reframe how people think about physician supply and demand, and that the data each customized criteria selection yields will help educate and engage shareholders to create actionable workforce policy," end of quote. Next, global well-being improvement leader Healthways and the Gallup organization have developed Gallup-Healthways Well-Being 5, a trademarked, comprehensive, scientifically validated survey instrument said to measure, report, and track the strongest predictor of health and performance outcomes over extended periods of time, and that is measuring well-being. In fact, the partners say they can measure the 5 interrelated elements of well-being, those being purpose, social, financial, community, and physical. They also claim to have created the world's largest, most diverse data set on well-being, providing unparalleled well-being insights in terms of depth, accuracy, as well as value. Gallup chairman Jim Clifton called well-being, quote, "the most important dial on any leader's dashboard for the next 20 years," end of quote, and added that improvements in the area will mean substantial performance and productivity gains for businesses. Meanwhile, Healthways president and CEO Ben Liedl Jr. noted the shared interests of consumers, employers, health plans and systems, as well as communities in formulating a baseline for well-being and then systematically measuring change as it happens. Moving on, one of Obamacare's stated foremost purposes has been to expand affordable health coverage. There has been no shortage throughout this year of speculation, both very pro and very con, about the 2015 price tags that individuals and family health plans could actually look like. ChristianPost.com is reporting a PwC preliminary look at health insurance premiums for 27 states as well as the District of Columbia next year. And it appears that pricing will not increase as much as in pre-Obamacare years. You may recall that the national average for insurance premiums grew about 10% a year between 2008 and 2010, and in 2011 it actually hit 11.7%. But the anticipated boost of 7.5% for next year, quote, "should be viewed as a huge victory." That, according to Jonathan Gruber, one of the architects of the Massachusetts law that predated Obamacare. Gruber also worked on creation of the Affordable Care Act. State-by-state price increases will vary. For example, Florida premiums may jump 13.2%, but that figure has to be understood in context because it actually grew by 37% in that state in 2014. On the other end of the pie spectrum, Oregon residents could see a 2.3% drop in 2015. Finally, Claudio Teri, CEO of Dr. Social, believes that the proven willingness of hotel customers to review their stays on TripAdvisor portends a successful strategy for him in which patients will review their physicians. Teri studied reviews from 50 hotels and approximately 3,000 rooms, and those represent only about 2% of the typical hotel's customer base. And he reached a positive conclusion about the potential for his so-called Dr. Social website. Teri claims that replicating the TripAdvisor approach will improve medical services and populate Dr. Social with sufficient number of reviews from many doctors. He admits that obtaining physician engagement will be the key. That's this week's Pharma Research Video Report. A reminder that this video is available in the cloud if for some reason you cannot access it on YouTube. And you can also download the RBDR app on the Apple Store, and that will enable you to actually watch Pharma Research Video Report on any iOS device. Please share Pharma Research Video Report with your friends and peers in the business, and in the next week, have a great research time, and we'll see you soon.